I truly believe that everyone should have health insurance. Buenos dias. I feel terrible for people who cannot access medical care. And that's why we do what we do. We try and fill that hole, at least to some extent. Ask her how long the headaches last. We don't ask if they're citizens. We don't ask if they're under flight from the law. Tell her I think that the headache is coming from some arthritis in her neck. We just take care of people. Ira Ehrlich is my name. I'm a volunteer physician at the Mission of Mercy. My father was a doctor. I used to go on rounds with him from time to time. I attended undergraduate work at Stanford, went to medical school at Harvard. I was a cardiologist. I was in private practice here in Phoenix for approximately 42 years. When I retired, it was apparent to me that I was not done practicing medicine. So I was aware of the fact that there were volunteer opportunities available, and I started looking for them. Hello, girl. I receive zero monetary compensation, but I receive a great deal of compensation in terms of the good feeling that I get being there, the ability to come home feeling that I've done something nice for somebody. I've made a difference in their life. So that is compensation.
I have been for some period of time a volunteer driver of the 43-foot van. That van not only has the rooms in it to see the patients, but it has the medicines that are vital to them. And it's so fulfilling to me that I'm in charge of a pretty expensive piece of machinery that's going to bring something so vital and so necessary and so needed.
You're going to cut it in half. And then he said, if you don't feel good, then you can take
My name is Paul Scherb. I've been here 3 or 4 months. I worked prior to at Goodwill Industries. Lost that job. You know, Arizona's already got a super high unemployment rate. There's not a whole lot of people that are looking for 60-year-old people to work, period.
They have a very good dental clinic.
My wife gets Social Security. Oddly enough, although we feel poor, we're not poor to the state guidelines. Did it reach that point yet?
Yes.
Okay. If Mission of Mercy wasn't here, then I would just be without health care. I couldn't afford the drugs, I can't afford the doctor.
The people that we see are not lazy. The people we see are in trouble. Most of them are very hard-working people. They're just not people with resources or insurance. They're trying their best in a tough situation, and we're trying our best to help them in that tough situation. And you've had some pain in your chest off and on? Where is that? Every patient who you see presents you with a puzzle. After solving that puzzle, you were able to actually do something positive. How about salt? How much salt do you eat? That I'm no longer told by an insurance company what I can do for a patient and what I can't do for a patient. How much does it go down? So at the Mission of Mercy, I can take all the time I want. And I think the patient leaves with the feeling that they've actually seen a doctor and have been listened to. It's very pleasant. It's very pleasant indeed.
I appreciate it. Thank you
Pleasure.
very much.
You bet.